Hello dear colleagues, how are you? My name is Mynzhylky Berdikhojayev, and together with my colleague Sümbetov Davlet, we are in Presidential National Hospital in Almaty. The patient with the multiple stenosis. Just a second. На экране что видно? Рома. Этот референс стоит, да? Референс алып тастайсызшы? The gentleman, 58 years old, yes. Previously stented. We did angioplasty and stenting for the right ICA, and patient had a hemiparesis on the left side. Yes, on 3D you can see the critical stenosis of the right PCA territory, and patient were stented for the ICA, for the nearly subocclusion, and coronary stents were placed, and now patient has also slight stenosis on the V1 segment on left side. 4.4 should be, and it's nearly 3.2. It's not significant. And in intracranial circulation, it's look like stenosis, but on 3D there is a fenestration of the proximal basilar, and critical stenosis of the right PCA, slight stenosis left PCA, and patient had hemiparesis on the left side. That's why we think that the PCA territory indicated for the treatment. This territory in basilar looks like critical stenosis, but there is a fenestration. And here also the similar things, and the right PCA is critically stenosed. We have experience with the stent intracranial stenosis, and in long term, in most of the cases, it's effective. We are collecting data. Maybe one day we can publish it. The left MCA territory also stenosed, but on the left side there is no symptoms. I think we can follow this territory with the medical management. It's severe but no symptomatic, and there is no delay on the venous phase on the left side. That's why we will follow on medical management. And this territory critically stenosed, and the basilar with fenestration, I think we don't need to treat this. We will just place a credo stent here. 8 French guiding, and now you can see the fenestration of the basilar artery. Slight stenosis in distal vertebral, but I think there is no indication to do anything, and this is nearly subocclusion. CT doesn't show any significant changes, and that's why we will do the right PCA territory. Headway ашты ғой, да? Headway и 5-30 деген керек. Credo 5-30.
Açarı var.
530 кіреді бар ма?
Кіреді. Ең үлкен 520.
Жоқ, ұзыны, қайсысы? 430 бар ма? 530, 430.
4, 20.
Бәрі 20 ғой, да?
4, 20, 5, 20.
Açarı var. 420.
Жоқ. 420 мен 520 дайындап қоясыңызшы. Okay, maybe we'll place two stands. Let's see. 520 ашып бере салшы. Бақыт. Жоқ. Кіреді. Yes, I like my colleagues and they can work in any condition, and the screen could be not so suitable, and they can work, and I couldn't change this behavior. I don't like this setting of the screen. It's not so comfortable for me, but I think it's comfortable for my colleagues. Huh? Okay. All patients from the previous days are okay. All MCA aneurysms from yesterday are okay, and I hope they will be at home for the New Year celebration. Contrast. Осы проекцияны қойсам. 8:20. Ультравесный. Yes, I asked to do 3D angiography and CT to be sure that there is a problem, because on the angiography from subclavian, even with the 8 French guiding, it was not so clear what kind of pathology we have to treat. And now this situation is clear. Yes, today is 27th of December. We have another one patient for today, and in the morning my colleagues Maksat and Shaykh made a treatment for the IC aneurysm, the incidental one, but usually they don't want to do live streaming. I can understand them. It's not so it's not so comfortable to be on media, and I understand them. Не болды аға? Қимылдамай жатасыз ба? Yes, the treatment under local anesthesia. That's why patient is doing significant movement. Stop. Назад. Okay. as usual. I don't know why, but usually the wire is going to the different territory, not for the dedicated one. Okay. Now we are in the territory. We need to go distally. This territory is better. Гипедин керек болады, айтам. Yes, we would not to do angioplasty. The stent itself will do it. 5 минут істейді. Прошу. We took 8 French coronary guiding Hyperion through the short medical prelude sheath and Baltway connector, and took a 156 centimeter headway door. And we navigated headway doors with the Chikai Black. And now the Credo 520 is on the way. It's comfortable to use Credo through the headway door. Okay. I think the one stent could be enough. Ого, не болды?
Қимылдамаңызшы.
Қимылдамаңыз, аға, қимылдамаңыз. Қимылдамаңыз. Yes, it's okay.
Не, 5 минут. Ага.
I'll capture the stenosis and we'll enter in the basilar. I think we can go a little bit distal. We can start stenting here. The mid portion of the corridor is with more radial force. That's why we'll do it like this. Huh? Yes, now it's better. Yes, on lateral, it looks like the stent is opened. On AP, okay. Okay, we'll take it out. We have a balloon 125 by 9, but usually Credo is doing the job by itself. That's why maybe we don't need. But stent is located at the orifice of superior cerebellar artery. Okay, maybe we need to place one more Credo. Анау естественно қарап қалды. Назад. Вперед. But it could be okay, huh? It could be okay. Ya ойлап тұрмын. Керек па? Yes, usually it will work. We can follow. There is a problem with the wire.
Боковойды триматронсы, тормаги. Түскен сияқты бірінші.
Yes, the marker is not touching the orifice of superior cerebellar artery. That's why I think it's possible to finish like this. Let's do it in angulation. Дистальный маркердің тұсында артерияны өлшесер. Yes, we will measure the artery. And the treatment, просто маркердің тұсында артерия. Жоқ, перпендикуляр. Berdikhojayev. Okay, it's 1.8 millimeter. Ну-ка вперед. It's not touching the orifice. It will work by time. The stent has a radial force, and I'm not sure if we need to do angioplasty. Подожди, где диаметр решишь? Да. Might be, but I'm not sure. It's less than 2.2. Okay. Okay. Just a second. There is a branch. Okay, let's try to retrieve the catheter. Sometimes it works, sometimes not. Okay, the René technique is working. René is doing like this, and we could do the catheter retrieval. Bachet. Okay, let's do angioplasty with the 1.29 balloon. 1.25 9. Астында, ең астында. 1.25 9. Aşağı insin. Okay. Так, индифлятор вирусал. We will do angioplasty from mid portion, middle portion,
Бар, контраст бар ма?
and the problem number 2.
Пока бар.
Чекай black may cause little bit friction. Anasır. Yes, it causing the friction. Stop. Okay. It's a problem with the Чекай black. This one. Vienki gizesir. Turkish. Okay, just a second. It's a normal friction with this kind of balloons. Stop. Yes, we are inside the artery. It's nearly impossible to push it. Okay, I think no need. It's impossible to push it with the cable. It's stuck on the wire. Okay. Тоже керир. Yes, everything is clear. It's a technical point, huh? Она диаметр учится с центрального жерда, максимальный стеноза. Xeon and Chikai Black is the same technology, 14 wires, but yes, in this case it doesn't want to go. Аға қимылдамаңыз, қимылдамай жатыңыз. 1.2, yes, now it's better. Okay. Қимылдамаңыз. Yes, the artery is patent. Now I will ask David to do expert CT. Yes. Yes, the artery became bigger, 1.2, and by the time it will be larger. 1.2. It's less than 1.2. It's nearly 0.9. And let's see how much it was at the beginning. This is after placement. This is before the placement. 1.7 it was the proximal part. 1.4 was this part. Так, звук пока есть, да? Okay, let's measure. It was like this. .6. Now it's 0.9, and by the time it will be even larger. And at this point 1.6. Now it's 2.2. Okay. It's not the same position. This is the same position. Okay. Let's do CT control, and we'll do CT angiography in 3 months and angiography in 6 months. Okay. CT is ready. This is credo. And, this is the brain. Brain is clear. Now we can finish this case. Next case, brain aneurysm in 20-25 minutes. Thank you for watching. See you.